Hi, good afternoon, viewers. Today I have with us Dr. Shantala Thuppana, Senior Consultant HOD Gynaecology in Sakra World Hospital. Thank you, ma'am, for joining us.
Hi.
She will be discussing on fibroids today, which is very important for women age group. And the first question would be, what are uterine fibroids?
See, as many times I have discussed about the fibroids, still many have so many queries about the fibroids because most of the women, around 40 to 50% of the women have fibroids. That's why they were more concerned why it is so common, and all these things queries will be running in most of the patients. That's why we thought of discussing again with the fibroids. So it's one of the fibroids are uterine tumors. They are usually not cancerous, benign tumors which are starts from the uterine muscular layer of the uterus. So it's very common tumors.
Okay, doctor. Doctor, how big they can grow?
Usually as small as millimeters to like a pregnancy size. Means in my OPD, I have seen multiple times the patients coming like a pregnant woman, but the whole tummy is filled with fibroids. So it can grow to a large as football size, so like a baby. So it varies from different sizes, as millimeters to as big as football size also.
Okay, doctor. Doctor, can you please tell us what are the types of fibroids?
The fibroids depends the how it grows. Like on the uterine lining, if it grows on the surface, or it grows within the muscle layer of the uterus, or sometimes the inner lining of the uterus. Depending on the how it grows, we call as submucosal fibroid means inner lining. The intramural fibroids means within the muscle layer, and on the surface, it is called as a pedunculated subserosal fibroids. Usually, the patients with the inner lining fibroids within the muscle layer fibroids, they present to us early because they have symptoms, because they are more towards the inner line. They come with the more symptoms with a smaller size also.
And what are the causes of fibroids, doctor?
There is no specific cause has been found for the fibroids, but the family history, if they have, they are in high risk of developing the fibroids. Genetically, African patients have higher incidence of fibroids compared to Indians. And Western countries, it is lower compared to even to us. So, to certain extent, the hormones, estrogen and progesterone, has been blamed for the fibroids because it's very common in the reproductive age group where the estrogen and progesterones are in good amount, and most of the patients have shown a reduction in the size of the fibroid after the menopause. So it suggests that to a certain extent it is hormone related. So the risk, something like obesity, the family history, or those with high basal BMI may be prone for developing fibroids. So these are some of the risk factors and the causes for fibroids.
Doctor, how can this fibroids can be diagnosed?
Usually, diagnosis we will discuss in the future. First, how they will come to us, that is more important. So, how they will know whether fibroids symptoms. Patients, most of them have symptoms. So, they will come to know when they have a regular health checkups. Previously, not all many Indians used to do routine health checkups. Now, many are preferring to do routine screening after certain age. So, even without symptoms, many patients come to us after checking that I have fibroids by health checkup. So, what can we do? So, are almost asymptomatic, no symptoms at all. And patients who come to us with the symptoms, even with the younger or little late age, the symptoms are like when they come with a heavy cycle and prolonged cycle. Some patients in between the periods they can have bleeding. The once the fibroid is too big, they can come to us with a urinary problem, especially when it is compressing on the urine bag. So they come with a frequent urination. Means they feel like passing urine frequently. The fullness because of the compression on the urinary bag, it is unable to fill. So even if it is little bit full, they feel pressure. Some patients, when the fibroid, depending on the positioning, they compress between the neck of the bladder and the urethra, the outlet of the urinary bag. So few patients, even they have come to our OPD with total retention. They are not able to pass urine at all because of the compression effect of the fibroids on the bladder neck, we call it. So some patients are in emergency, they will land up with urinary retention. The other thing is pregnancy and infertility. Before that, they can even compress. When the fibroids are too big, they compress on the motion back. They come up with a constipation. Once we do the checkups, they will come to know that they have fibroids. Usually, these kind of fibroids grow very huge, or on the surface, they come to us late when they have a pressure symptoms. The other is infertility, means inability to conceive, especially if the fibroids are growing in the inner lining where the implantation and growth is not happening. Other things is when they are compressing on the fallopian tube. So these are some patients, they come with the infertility. Most of them, they come with the, when the fibroid is big, it is little bit on the outside the inner lining, they come with the abortions and pregnancy related complications in terms of pain during the pregnancy. Means the fibroids undergo changes called as a degeneration that can cause pain during the pregnancy, or sometimes the contractions. The premature, the uterus will contract, so it will lead to a preterm deliveries, false pain during pregnancy. There are chances that they can have an early delivery also. Patients have, after delivery, the other complications with the fibroid is huge, inability to contract the muscle layer of the uterus. So they will come up with a heavy bleeding immediate delivery on table only, either do cesarean or normal delivery, because these fibroids will affect the uterine musculature. So it is called as a postpartum hemorrhage, postpartum bleeding. So this is also one of the complications. Sometimes it becomes difficult to control after delivery with this kind of huge fibroids.
Okay, doctor. Doctor, when to consult the doctor?
Yeah, when to consult doctor? It's more important when the patient has all these symptoms like heavy bleeding, uh, painful periods, frequent urination, constipation, conceiving problem, all these things. When it is more, better to get investigated, and it helps us to diagnose and treat.
Okay. Doctor, treatment of fibroids?
Before that, how to diagnose the liver. So diagnosis usually, most of them on routine health checkup, they get diagnosed. Once we diagnose, on examination, when they come with the symptoms, if we think of they have a symptoms, when we examine, the uterus size can be bigger than the, on examination also we diagnose the fibroids. And routine is ultrasonography, the scanning. Pelvic scanning will show that uterine has some fibroids. The other tests are when we need more investigation, especially when the number of fibroids are more. It is huge, it is not able to visualize with the scanning, it is out of our probe size. And then when we are suspicious of any cancer, all those things, the MRI, which will indicate certain these diagnosis of all these things. He asked about the treatment. So, treatment depends on the symptoms, what trouble they are facing, and age. The woman who is facing these problems, what age they belong. So, we have options like a medical conservative treatment, and other is surgical treatment. Conservative, if we come medical, in terms of medical treatment, symptomatically when the patient is having heavy cycle, we try giving something like which will which will induce uh, contraction or something like anemia correction, which causing painful the painkillers, and then some of the blood clotting, which will affect the blood clotting. We can give all these things symptomatically and they have healing. The other thing is hormonal treatment. Hormonal, some of them are like a contraceptive tablets. They are not like something permanent treatment or curative or temporary. The other hormones, like a GnRH, we call it as these hormones acts by preventing the estrogen and progesterone production by suppressing ovaries. So by suppressing hormones, the fibroids also shrinks in size to a certain extent. But the long-term effect is, we cannot tell this. Why means once with the effect goes up, they may return to the normal size after certain months. This hormonal effect. The other conservative treatment is something like a uterine artery embolization, where some particles are put inside the uterine blood supply, which will be done by interventional radiologist. That is should be done for the specific fibroids depending on the position, size, and the age, whether they're planning pregnancy, because we cannot give those who are planning the pregnancy because it may affect supply to the uterine ovarian blood supply also. So we don't recommend those who are planning pregnancy with infections. The other thing is radio ablation or radio frequency ablation for the fibroids. All these are something like how much extent the reduction, all those things we have to assess post procedure. The other is more definitive, something like a surgical options are removal of the fibra or removal of the uterus. This will be taken depending on the age of the patient, depending on symptoms, depending on when they want to conserve the uterus or they want to take out when they decide. After we discuss with them all the factors what they have, after whether they completed the family, whether planned pregnancy or previous surgical problems, all those things we discuss with them. Regarding fibroid removal, uterus removal, previously we used to do open surgery. All these things routinely we are doing through keyhole surgery, laparoscopy. With laparoscopy, we have a high definition cameras, 3D cameras. We have a robotic facility. With all these things, we have a lesser cut on the tummy, the lesser blood loss, the faster recovery, the less pain. All these advantages with more precision because of high definition cameras, 3D cameras. The because of high frequency resolution, we have more precision of surgery with this kind of high technology.
Thank you. And to summarize, can you please tell what are the common misconceptions or common doubts what generally people will have on fibroids?
Mainly, the question most of the ladies will have whether the size of the fibroid will regress over a period of time. This is the question. When they come without any symptoms, when they see the fibroid. See, it depends on the age. Younger patient, few patient very rarely regress because the hormonal activity will be very good. Few patient it may be a same size. Most of the patients who are reaching the menopause, post menopause, we have seen the reduction in the size of the fibroid going abnormally fast. Either in young age or the older age, it's not very good. The next thing, when they remove fibroids, especially younger patients, the next question frequently goes into mind is whether they should undergo cesarean or normal delivery. Is it possible for once you remove the fibroid? Yes, because depending on the fibroid size, how much depth of the fibroid which has invaded the muscle layer of the uterus. Because as I discussed initially, the type of the fibroid is on the surface, the muscle cut on the uterus may not be so big, not so in depth. In those cases, the cut on the uterus may not be too deep. So to remove the fibroid. In those patients, we advise you can try for normal. When the fibroid is too deep inside the muscle layer, it is invaded into the inner lining of the uterine cavity, because reconstruction will be something like a again cesarean cut on the uterus. So those patients we advise to not to try for the normal delivery, because it's like a cesarean scar. The chances of opening up of the scar may be high. So the surgeon who operates usually advises, depending on the different patients who we have operated, we tell them don't try for normal delivery, you can try for. Other query is whether once you remove the fiber, whether you get the fiber. These are the common questions I get in the OPD by most of the patients. Yes, because especially in the multiple fibroids, even the scanning has picked up MRI, many fibroids. There are some microscopic lesions in the uterine layer, especially when you have multiple fibroids. We try removing whatever is seen through laparoscopy, whatever we through images, if MRI, minor one, we try taking. If the patient is very young and if they have multiple, more than 10, 15 like that, we try reconstructing the uterus in such a way that it will hold the pregnancy, not cutting everywhere on the uterus. So that uterus should be able to hold the pregnancy in the next when they try for pregnancy. So in those cases, we try removing bigger fibroids, those who are causing disturbing to implantation or pregnancy. A minute one, we don't want to put, if it is less than one, we don't want to put cut on the uterus, so that uterus can become very much unhealthy scrap. So in those cases, the recurrence are high. Even with a single fibroid, even with a single fibroid, chances of recurrence is like something like 5 to 10% in the future. So recurrence are there with the even with a single fibroid. Multiple fibroid chances are high. So other question is, many patients have query whether it can turn into cancer. Very remote chances. Very less than 5% after fibroids into cancer. Especially it is mostly in the menopausal range, and then the rapidly growing fibroids are suspicious for us. Otherwise, the cancers are very less.
Okay, doctor. Thank you so much for your time and valuable insights on fibroids. And thank you viewers for joining us. And to book your in-person appointment with Dr. Shantala Thuppana, you can log into our website and book appointment, or you can just download our app from Play Store, Sakra Patient app, and you can book appointments with it. And keep following us for more health insights. Thank you.
Thank you.